Namaste, welcome back to EduCardioWise. In our first video, we explored cholesterol, the good, the bad and the ugly through a fun Sholay analogy. Gabbar, Jay and Viru helped us understand HDL, LDL and triglycerides in a way that was engaging and easy to remember. If you haven't seen that video, I highly recommend watching it. It's a blockbuster in its own right. But today, we are shifting gears to take a closer look at how cholesterol actually causes heart disease. Think of this as a second act in our cholesterol series, where we go from storytelling to understanding the science behind the story. By the end of this video, you will understand what cholesterol does in your body, how it contributes to plaque buildup in arteries, why inflammation plays a critical role, why cholesterol is a risk factor and not a guarantee for heart disease. So let's get started. Cholesterol often gets a bad rap, but it's essential for your body. Now think of it as a multitasker with some crucial jobs. It builds cell membranes, acting as a structural framework. It helps your body produce hormones like testosterone and estrogen. Your liver uses it to create bile acids, which helps digest fats. And it's even a key ingredient for making vitamin D. Now let me give you a quick fact. Your liver makes about 75 to 80% of the cholesterol your body needs. The rest comes from food like eggs, dairy. So if you have been avoiding eggs like the potholes on the Mumbai roads, relax. Dietary cholesterol isn't the main culprit. Since cholesterol is a fat, it can't dissolve in blood. Now instead, it travels in tiny packages called lipoproteins. Now first is the HDL or the high density lipoprotein, often called as the good cholesterol. Now HDL picks up excess cholesterol from your bloodstream and takes it back to the liver for recycling or disposal. Second is the LDL or the low density lipoprotein, often known as the bad cholesterol. Now LDL delivers cholesterol to your tissues, but too much of it can cause plaque deposition, which we will understand today. And there are others like VLDL that is the very low density lipoprotein, and IDL or intermediate density lipoprotein, which you don't need to know. This is not a science class, of course. Next comes triglycerides. Now these fats store energy, but when their levels are high, they add to the heart disease risk, especially when combined with low HDL and high LDL. We have called HDL the hero and LDL the villain in the last video. Now let's see how this villain creates chaos in your arteries. Okay, let's imagine your arteries as smooth, flexible highways designed for blood to flow freely, delivering oxygen and nutrients to your heart. But here's where the problem starts. LDL or bad cholesterol can act like litter on this highway. Over time, these cholesterol particles stick to the walls of your arteries and they attract more and more debris, like a snowball rolling downhill. This sticky buildup is what is called as plaque. Now, plaque isn't just cholesterol, it's a mix of fats, calcium and other substances in your blood. It's like the grime that clogs your kitchen sink over time. It starts small, but if it ignored, then it can create a major blockage. Initially, the plaque might sit quietly, just narrowing your arteries. But as it grows, it hardens, making the once flexible arteries stiff, just like the rusty pipe that can't bend. This limits how much blood can flow through. Now, if your heart isn't getting enough oxygen, it can cause symptoms like chest pain, which we call angina. Do you know how the world realized the relation of LDL or bad cholesterol to heart disease? Now, let me tell you the story of two groundbreaking studies that forever changed the way we understand heart disease. First is the Framingham Heart Study. Imagine a small town in Massachusetts in the USA where researchers followed the lives of over 5,000 people for decades. They measured their cholesterol, blood pressure and lifestyle habits and then tracked who developed heart disease. The results? The people with high LDL cholesterol levels were far more likely to suffer heart attacks than those with lower levels. Now, this study was like a detective uncovering the smoking gun linking LDL to heart disease. Then came the 7-country study. Now, researchers went global this time, compared diets and health in 7 different countries. And they found that populations with high LDL levels caused by diets rich in saturated fats had higher rates of heart disease, while those eating heart-healthy diets like the Mediterranean diet had far fewer cases. Now together, these studies proved that LDL cholesterol isn't just a passenger in your blood, it's actually a troublemaker behind the blocked arteries and heart disease. And that's why managing your LDL is very important to keep your heart healthy. See, plaque buildup alone doesn't explain most heart attacks. The real danger comes from inflammation. Now here's how it works. When LDL cholesterol sneaks into your artery walls, it oxidizes just like a food that is left out too long. Your immune system sees this as an invader and sends white blood cells to attack it. Now, this is what sparks inflammation. Now, at first, this process is like a small campfire, helpful and controlled. But if LDL levels stay high, this process continues and the inflammation grows into a wildfire. It weakens the walls of the plaque just like a wildfire burns down trees, making them fragile and prone to rupture. One wrong move, say a sudden spike in blood pressure or extra inflammation, and this plaque can rupture. Now, when the plaque bursts, your body tries to put out the fire by forming a blood clot. Unfortunately, this clot can completely block your artery, cutting off blood flow and causing a heart attack or a stroke. It's sudden, dangerous and life-threatening, just like a volcanic eruption. And that's why managing inflammation is just as important as managing SDL. Now, the Jupiter study showed that even people with normal cholesterol but high inflammation levels in the form of high CRP values significantly reduce their heart attack risk by lowering inflammation with statins, that is cholesterol lowering medications. Now, let me share a common scenario I see in my clinic. A patient walks in, looks worried and says, "Doc, I have been having chest pain. I think it is because of my high cholesterol." After a detailed evaluation, I tell him, "See, your cholesterol levels are indeed elevated, but they aren't directly causing your chest pain. High cholesterol itself doesn't hurt or cause symptoms. It's what happens over time. See, if your LDL level is high and HDL is low, it increases your risk of developing plaque in your arteries, which over years can lead to a heart attack or stroke. But chest pain from high cholesterol isn't immediate. It's a result of long-term damage from the untreated high cholesterol, along with other factors like smoking, high blood pressure, diabetes and bad genes." So in his case, the chest pain turned out to be non-cardiac, likely related to a muscle strain. But this was a wake-up call for him. High cholesterol is a silent risk factor. You won't feel it, but it quietly increases your chance of serious heart disease if left unchecked. So what we need to do is follow a plan: a heart-healthy diet, regular exercise, and follow-up cholesterol testing. So remember, cholesterol doesn't cause symptoms, it increases your risk. The high levels could be because of several factors, like some people have familial hypercholesterolemia, that's a genetic condition that causes high LDL levels. Others might develop high cholesterol due to poor lifestyle choices like eating too much saturated fat, not exercising. By addressing these risk factors, you can significantly reduce your overall risk. So to sum up, cholesterol is essential for your body, but balance is the key. High LDL and inflammation will increase your risk of heart disease, but that can be managed with lifestyle changes and medications. Regular testing and preventive measures are your best defense. So this was part 2 of our cholesterol series. In the next video, we'll decode cholesterol numbers and help you understand what they mean for your health. So if you found this video helpful, please like, share and subscribe to EduCardioWise. Let's take charge of our heart health together.